Let's look at the skills you'll be learning and practicing, particularly static apnea, dynamic apnea, free immersion, and constant weight freediving. Freediving is exercise, so prepare by warming up with light exercise, followed by gently stretching and making sure you're hydrated. If you don't know how to stretch, see a physical trainer or your instructor. Put on your wetsuit just before entering the water so you don't overheat. Defog your mask. If using a weight belt, put it around your hips so the buckle has a right-hand release. You don't want to walk wearing bifins, so don them by the water. They go on easier if you wet them first. Then, put your mask and snorkel on as you've already learned. How much weight you need depends on your physical characteristics, your gear, whether you're in fresh or salt water, and the type of freediving. Your wetsuit is usually the main buoyancy factor. For open water freediving, you should float comfortably at the surface after exhaling, but be neutrally buoyant so you don't sink or float at a deeper depth after starting with a full breath. Your wetsuit and air in your lungs make this possible because they compress and lose buoyancy with depth. For constant weight and recreational freediving, a common approach is to be neutral at 5 meters or 15 feet or 1/3 your planned maximum depth, whichever is deeper. Some divers use 10 meters or 30 feet and others half the maximum depth. Regardless, you should float comfortably at the surface, even if that means wearing less weight. As you pass neutral buoyancy depth descending, you begin to sink slowly. As you descend further, you lose more buoyancy. This allows you to glide and relax. Swimming up, buoyancy returns as you pass this depth, bringing you up faster. And, for safety, you're buoyant in the range where most blackouts occur. For shallow dives, like in the PADI freediver course, you may be buoyant the entire dive. Setting your weight takes a bit of trial and error. With a small amount of starting weight, go to the desired depth along the drop line and see if you sink or float. If you sink or float more than very slightly, adjust in 1/2 to 1 kilogram or 1 to 2 pound increments. Breathing for free diving is diaphragmatic breathing. Inhale. Your abdomen should expand, filling your lungs so your abdomen expands, then your chest, and finally your shoulders rise slightly. Relax and exhale, letting the air out slowly. Relax as you breathe. The more you relax, the longer you can hold your breath. Diaphragmatic breathing and relaxing are the cornerstones of freediving. First is breathe up, that is, preparing to dive by relaxing. Relax, breathing slowly for at least 1 or 2 minutes. Breathe slowly. Then inhale a final, comfortable, full breath and hold it. During the dive, relax, holding your breath. Do not exhale underwater during the dive. Your body needs the oxygen, and in open water, you lose buoyancy and can increase blackout risk. You may exhale gently just before you reach the surface. When you come up, your first breaths are important. Exhale about half your breath gently and passively, just as you reach the surface. Then inhale quickly and deeply. Do this 3 to 6 times. Forceful exhalation can trigger LMC or blackout. After a few breaths and your breathing returns to normal, let your buddy know you're okay. After the dive, your body needs time to restore oxygen and remove carbon dioxide to normal levels. Wait at least 3 times your breath hold duration before starting another dive. Wait for your turn to dive again. Stay relaxed, breathing from your diaphragm, even though you may be doing something like watching a buddy. You'll probably begin with static apnea. There are no descents, so you usually wear only your suit and mask or swim goggles and a nose clip. For a static apnea attempt, start with relaxed breathing and hold your breath as you just learned. Then relax face down, letting your wetsuit float you. Stay calm. Relax. Listen to the water. Start with short durations and increase slowly. Get into a fixed position before lifting your face from the water. After secure on all 4 points, exhale gently about half your breath as you lift your face and start your recovery breathing as you learned. Your buddy times the attempt and taps you at regular intervals. Safety procedures are important, so the taps are part of checking on you regularly. You must respond with a distinct hand signal. Failure to respond after 2 taps or other sign of possible problems ends the attempt. Let's look at the descending and ascending steps that generally apply to freediving. You want to start a dive efficiently, so use the duck dive, which uses leg weight to start your descent. As you take and hold a full breath, remove your snorkel and kick gently forward like this. Stop kicking and sweep your arms straight down. At the same time, use your momentum to lift your legs straight up. The higher and more vertical, the more downward thrust you get. Begin equalizing and glide downward until your fins submerge. Then begin kicking to continue your descent. Ascend as planned with your buddy. Don't push your limits. Consider how long you need to ascend, and don't overstay your time down. The deeper the dive, the sooner you should ascend well within your limits. Ascend kicking strongly at first, then gently. As you pass neutral buoyancy depth, let the buoyancy help carry you upward. Remember, do not exhale until near the surface. Extend one or both arms for safety and so you're ready to grab support. Always use support after surfacing from a breath hold dive. Exhale gently and inhale more quickly at least 3 times and transition into recovery. You descend with no snorkel in your mouth. Depending upon what you're doing, you may leave your snorkel attached to your mask, or remove it entirely and leave it with a buddy, floating or tucked in your weight belt. Swimming as a freediver, kick from the hip with little or no knee bend. Your legs should form at least a 45-degree and no more than a 60-degree angle. Wider or narrower than this wastes energy. Move through the water powerfully, with a feeling that it is a relaxing effort, not overly fast or slow. Some divers glide with each kick. Upper body position depends upon the dive and activity, but keep your torso straight in all cases. This position is common in training and competition. But in recreational diving, lift your chin to look where you're going. It's best to not look up ascending, because tilting your head can cause blackout. When recreational freediving, reach up for protection, and in all cases, secure support immediately. For dynamic apnea, after relaxing, take a breath. Descend and follow a line on the bottom. Start with distances you can cover easily and increase your time and/or distance slowly. You may push off when you turn. Ascend and breathe as you've already learned. Use the pool edge, a float, or a lane marker for support. Always use support after a breath hold dive. During your buddy swim, watch for problem signs, such as changes in swimming patterns, sudden speed changes, stopping kicking, tremors, or a sudden release of air, which can indicate a blackout. You may also time the swim. Free immersion is a good way to learn to equalize and descend by pulling yourself along a weighted drop line. You also use it when adjusting your weight. You don't wear fins in competition, but you usually do in training. While breathing relaxed and with your safety lanyard attached to the drop line, take a breath and pull down the line. Stay close to the line. You may descend head first or feet first. Equalize frequently. As you pass neutral buoyancy depth, descending gets easier. To ascend, use the line to slowly pivot head up. Pull slowly and steadily to the surface. It gets easier as you pass neutral buoyancy depth and become buoyant. Reach up to grab a line or float for support as you surface. Be conservative as you extend your times and depths. Pay attention to your body. Don't push yourself to reach a depth goal, and don't exceed your planned depth. Begin back up with ample breath remaining. Use your static apnea and dynamic swim training as time guidelines, and allow ample recovery between dives. Open water buddy procedures begin with communication. Your buddy should know your planned depth, time, and what you're doing. Only one person on the team dives at a time. Agree on signals you use. Don't start your dive until your buddy has recovered from a previous dive. Speak up if you're not comfortable about providing support for the dive. Your buddy escorts you through the final third of your ascent, or at least the last 5 meters or 15 feet. If you have a problem, your buddy brings you up and begins rescue procedures. After you recover, you switch roles. Constant weight freediving uses similar procedure to free immersion, but you swim to depth. Start by relaxing next to the float. Clip your safety lanyard to the drop line if using one. Take your breath and duck dive. Kick strongly at first. As you pass neutral buoyancy depth, descent gets easier, so ease up and relax. Equalize frequently, and stop if you can't equalize. When deep enough, glide to save energy and oxygen. To start back up, grasp the line, brake, and pivot slowly. Avoid rapid turns. Pull firmly once to start upward. Don't use the line to ascend unless you need to safely reach the surface. Again, don't push your limits. Make your turn with ample breath remaining and allow ample recovery between dives. You kick hard at first, but it gets easier as your buoyancy returns. As you pass neutral buoyancy depth, buoyancy makes your ascent easier and faster. Buddy procedures are basically the same as for free immersion, including escorting you up for safety. As always, reach up and secure support as you surface. Signal OK to your buddy after your recovery breaths, relax, and recover fully before switching roles. Recreational freediving combines your freediving skills. You don't go as deep, but cover more distance horizontally, applying both dynamic and constant weight freediving skills. Again, don't push yourself, and begin your ascent with ample breath hold capacity remaining. Usually, you don't use a drop line or safety lanyard, but your buddy follows you with the float for resting when you come up. Your maximum depth should be less than with a drop line. Work up to deeper depths. Buddy protocols apply, including escorting the final portion of the ascent. A good idea is to share a single camera or other accessory. That removes the temptation for 2 people to dive at the same time. In lower visibility, limit horizontal travel. Descend and ascend in the same place and set time limits. There are many techniques for entering and exiting the water, with the controlled seated entry, popular from pool sides and platforms near the water. With most entries, start with your mask, fins, and snorkel in place. Make sure the entry's clear and your buddy's ready. Put your hands on one side, pivot, and lower yourself in. Make room for other divers and signal that you're okay. Use the seated back roll from unstable platforms and small boats. Sit close to the water, hold your mask, and lean back. Keep holding your mask until you're stable on the surface so you don't lose it. Use the giant stride when you must enter from an elevated height. Hold your mask firmly with one hand and your fins under your other arm. Look straight ahead and step in. Then put your fins on in the water. You'll use the ladder exit a lot. Make contact, hand up your weights and fins, then climb up with your mask on and snorkel in place. Don't get under divers on a ladder, in case they accidentally fall back. Use the ladderless exit for poolsides, docks, and other platforms no more than about a meter or 3 feet above the water. Hand up your weights, then push and kick up into a seated position. Or lower yourself face down on the platform, then roll face up. Entering through shallow water after checking that the area is clear and your buddy's ready. Wade in, mask on, snorkel in place if waves may splash on your face. Carry your fins and tow your float. Put your fins on and begin swimming as soon as the water is deep enough. To avoid injury from organisms or debris on the bottom, it may be wise to wear sneakers, sandals, or wetsuit boots and stow them when you put on your fins. In training, you'll practice rescuing a diver simulating a blackout. Let's look at the steps you'll follow. Swimming the free diver to the surface doesn't have to be fancy. Any method that gives you control, keeps the head from tilting back, and lets you surface the diver supine works. Holding and swimming the victim from behind is an option. And from the side works well too, especially if you're too small to reach across the diver. Some rescuers advocate lifting by the head, but this must be done so the head doesn't tilt back. With all methods, if your size allows the hand positioning to do so, hold the victim's mask in place and mouth closed. At the surface, discard weight belts if not already dropped. Remove the mask and provide support, keeping the diver's nose and mouth out of the water. Blow sharply on the victim's face, which helps stimulate breathing. Tap and talk to the diver, encouraging breathing as you tap. Do this 3 times for 10 seconds. Call for help if the diver doesn't respond. Reach under the victim's arm and support under the neck. Use your other hand to open the airway by lifting the chin and tilting the head. Listen for breathing. Watch for the diver's chest to rise and feel for breath on your face. If there are no signs of breathing, begin rescue breaths. Give 2 slow, full rescue breaths. If the victim's mouth is tightly shut and won't open, give mouth-to-nose breaths. Check again for breathing after the first breaths. Then, give a breath every 5 seconds, keeping the airway open if the diver still hasn't resumed breathing. Continue with the breath every 5 seconds, keeping the airway open. Stop rescue breathing if the victim begins breathing, which in freediving is common after a few rescue breaths. Begin towing the victim towards safety, the nearest boat, shore, or other divers. Get the victim out of the water. If the diver's still not breathing, keep giving rescue breaths during the exit. Contact emergency medical care. check for a heartbeat and begin CPR if needed.